Hi, good morning. Rachel with Evergreen Certifications. Thank you for joining us today. Today, we're here to talk about our new end of life care specialist certification here at Evergreen Certifications. I'm going to pass it over. We have an advisor with us here that we're going to be going through some questions, talking about the certification, its benefits. So I'll pass it over to you. Would you like to introduce yourself to our audience?
Sure.
And then we can hop right into questions.
Sure. Rachel, thank you so much. It's just my honor and privilege to be a part of this, like off the ground, off the bleachers, kind of launching the end of life care specialist. My name is Lores Vlaminck. I've been a registered nurse. Oh my goodness, I had to do the math. 46 years.
Wow, impressive.
Well, it has been awesome. I would do it all over again as far as going into nursing. 35 of those years have been focused not only on sort of general home care, et cetera, but also hospice and palliative care. And I had to think, I started our Medicare certified hospice program in 1989. So that wasn't much after Congress actually passed the Medicare benefit. I forget, I was kind of an infant back then. And here it is 35 years later. So it's great to be on this platform with you, Rachel.
Well, before we hop into questions, that just made my brain kind of have a bunch of questions about you. So, specifically, palliative care, end of life care, hospice.
Yes.
Talk our audience through a little bit of what attracted you to that field and why you're so passionate about that field.
Oh, thank you. And it's also a reason I'm having a hard time retiring because I'm so passionate about it. But in 1985, I won't bore you with previous details on my experience, but I was recruited to start a home health care agency in greater Minnesota. And what I observed, Rachel, is that we had more and more patients in home health who said, I really want end of life care to happen for me. And I would prefer, if possible, it be at home, although not always possible.
Mhm.
And so in 1989, 5 years later, I said, because of that passion, because of trying to respond to their request, I said, why not? Let's really look at developing a hospice team, and had a lot of support from physicians and the community. But I'll have to certainly share with you, most people didn't know what hospice was. And we still face this 35 years
Yeah.
later. What is it? What is palliative care? How is it alike? How is it different? And so, as you know, I've in the past recorded a portion of what we're going to be referencing today with PESI, and that is the difference between hospice and palliative care. And so it was out of compassion and passion that our programs were built, because you don't kind of build these programs looking for money, although that's helpful. But what I saw over and over again, Rachel, is my patients were my best teachers
Mm.
if I knew how to listen and how to ask those open-ended questions. Because in 1989, we had very little as far as educational opportunities, as far as training. There was no certification process. And in fact, to find information for our patients in anything but English was pretty impossible.
Mhm.
And so that's going to lead me to further answers to questions you probably have for me, Rachel. But that has just motivated me through the years. Just last week, I spent 2 days with a hospice agency. And again, it just reminds me there is so much opportunity for persons to expand their knowledge. And they want to. They want to do standard of practice. And so having a place to acquire that, to achieve it, is something I just want to applaud Evergreen for doing.
Yeah. I love that a place of compassion and passion. That's such a cool thing to say. Well, let's hop right into our questions here today. So, as we mentioned at the top of this, we launched recently a new end of life care specialist certification. Throughout this conversation, for those watching and those who will watch later, we have a QR code in the top left hand corner of the screen, as well as a URL at the bottom of the screen. That will take you to the site where you can find all the information on the certification, as well as information on trainings that meet the education standards for this certification. And I know throughout this process, you'll be referencing some of that, the information that they're going to learn through the education that's required for the certification. So let's hop right in. Why should a professional get certified in end of life care?
Oh, because it's the right thing to do. I will say that. And also, you will be joining a host of other professionals saying, certification is the way to go because there's some standardized learning that happens. And I also think it sort of forces us to listen to other disciplines and
Mhm.
to have the highest level of expertise shared with us. And as we'll talk about in a little bit, that is what you've done is you've recruited multidisciplines. Why shouldn't I learn about medications from a pharmacist? Not, where can I learn the best possible? And, the standards of practice do change from year to year. We
Mhm.
know that medications can change, our approach can change, our serious illness guide, our tools can change, and certification sort of brings us to that place. And we can get so busy with life, Rachel, that we forget to stop and say, ooh, what has changed? How could I do this differently or better? And we see more research also that is being done in end of life care. So, therefore, that brings us to the best practice that then answers your question, why should we be certified? And you know what? It's a pride thing too. It
Yeah.
really is. I always feel, and I still do, that the best way to empower ourselves and our staff is through education. It's not the dollar at the end of the day. It's knowing that I did what is best practice, universally accepted practice in caring for my patient.
Yeah. And I think too, part of, and this will come through as we kind of talk more about the next question with what's unique, but uh, our certification requires both education and direct patient care, but also helping the families, right? Because end of life is difficult for the families as well, not just the patient. And I think how cool if I was in that situation to know the person caring for my loved one had a certification and extensive knowledge in this specific topic area. So I think that's another great thing about getting certified is that you build confidence in your patients and the family members' confidence in your quality of care that you can provide to them.
Absolutely. Because I will say this, Rachel, in regards to hospice, yes, we admit the hospice patient and their family or their, whoever they describe as family. And that's really the model of palliative care, end of life care, too. And it's also something that I think, and maybe I shouldn't talk about it in this way, but I'm going to. It's a marketing strategy too to
Mhm.
say,
Yeah,
our staff are, they've invested their time and their effort to become certified because they are specialists. And I think I have watched patients and families sometimes take a deep breath to go, oh, finally somebody is here that
yeah,
is a specialist in this area and I can let my guard down. I can ask the questions because they're right in front of me.
absolutely. Yeah. Well, great. So let's move on to our next question. So, with this certification and the requirements for education around this certification, what makes it unique and what knowledge will professionals gain in end of life care by obtaining this?
Well, I think they should sign up and find out for themselves,
Yeah.
actually. But back to your first question, you've pulled together a phenomenal slate of 9 professionals that will speak to different issues, which we'll talk about in a little bit. But this certification is not only for nurses or only for social workers or only for chaplains, because you might find that in other venues. But this is for, and I'm going to glance over at my list so that I don't
Yeah.
miss
No, that's
folks.
fine.
And that would be, as I've already mentioned, the nurse practitioner, the registered nurse, the LPN, the nursing assistant, or the hospice aide, or the home health aide. And often that is a segment that gets overlooked. And we know that they often know our patients' fears and worries and families even better than the professional because they hear so much. And let's include them. Physician assistants, respiratory therapists, social workers, registered dietitian, nutritionists, occupational therapists, physical therapists, speech language pathologist, pharmacist, and that may even expand as time goes on into what we see as sort of our adjunct, music therapy, massage therapy, etc. So think about how it is that you could offer something to your whole entire team or to whet their appetite. And one of the things in looking at the speakers and the content, I have a question. How do we teach compassion? How do we teach passion?
Mhm.
And I think it's through modeling and watching other persons who are compassionate show it to us. It's not a book we can pick up. And that's one thing that's different about, I believe, this certification. There's going to be live and pre-recorded speakers. It's not sitting down with online learning and kind of just going through the objectives.
Yeah. Yeah, absolutely. I love that you segued into one of our next questions, covering the professionals that meet the certification standards.
Yes.
So as we talked about, this is like a healthcare and rehabilitation focused certification based on the content they'll be learning. But as we were working with yourself and the other advisors on the team, it became obvious that we all felt that end of life care really is a situation that involves not just one type of professional, right? It involves
Correct.
their team. And we worked hard to make sure that the certification could speak to multiple people within that care team. So as you mentioned, a wide variety of those professionals will meet. And I think looking, like you mentioned, looking at the staff, you're able to encompass almost all of your staff in one training because
Yes.
of the in-depth nature of what people will be learning throughout the
Mhm.
process.
Mhm.
Okay.
Mhm.
So moving on to our next question, the
Yes.
certification requires applicants to have spent a minimum of 2 years working in that healthcare end-of-life care setting.
Yes.
Why did you and the other advisors feel that that was an important number to be requiring those 2 years before obtaining a certification in this topic?
Well, I think as a new graduate of any profession, when you first graduate, you don't know what you don't know.
Yep.
And I think if in fact you have the 2 years experience, as you then go through the modules, you'll be able to attach your experiential, your scenarios to say, "Oh, that now makes sense," or, "Oh, next time I could," or, "You know what? I really do." It's affirmation too.
Yeah.
And you can't affirm somebody that does not have any experience per se.
Yeah.
So I think that 2 years, it also shows a commitment. Um, you know, End of life care is not for everyone.
Yeah.
Let's just say that because we all have different unique talents and specialties. So it gives that person, that discipline, a chance to be experiencing end of life care and then motivated to say, and I want to go further.
Yeah. Yeah. And I also I loved during the conversation and development with you guys talking through the importance of being able to think back on past experiences you've
Mm,
had in the setting and being able to bring
yes.
those to this training of, oh yeah, I remember this situation. This is exactly what was happening, and now I know
Yes.
how to improve on that or how to pull
Yes.
from past experiences to be able to get even more great knowledge and understanding of the education you all are providing.
Yes.
Awesome. So after the initial certification period lasts for 2 years, and after those 2 years, we do require individuals to renew the certification, which requires them to take 12 hours of continuing education in the topic of end of life care. Talk us through and our audience through why you feel it's important that people continue to get knowledge in this area.
I think it's a couple of reasons. It's affirmation for them, and it's also new knowledge because end of life care changes just like any other venue of orthopedic care or post surgery of some, I think of over the 46 years, oh my goodness, we used to keep people in hospitals, after a hip replacement for weeks in bed. Or, I worked in CCU. We would keep them in intensive care for, 2 weeks. And that's just what we've learned is that was not advantageous. So in end of life care, and I won't give away any secrets, but just an example will be in pharmacology. We have found some things that we tried, they've now been researched, and it's been found that it's really not that beneficial.
Mhm.
So by us hearing new information every 2 years, and that's one of the criteria too, that we look at new education,
Yep.
for that renewal process, not just repeating the same,
Yeah.
the same. And 12 hours in 2 years is not hard to acquire.
Mhm.
And I think there's many different ways to get that, but I think it's really important for people to stay current.
Yeah. And like you said, there's multiple different topics that relate to end of life care. So
Yes.
pharmacology, like you said, that might be an avenue you go down for a renewal topic.
Yes.
Compassion, right? Bedside compassion, things like that. So not only is, the 12, we felt like there's a wide variety of topics that
Yes.
can cover those 12 as well. And obviously, we know a lot can change in
Yes.
2 years. And
Yes.
we want individuals to be the most up to date and knowledgeable that they can in that area.
A good example of this is, Rachel, look what we've been through in the last 4 years. A pandemic.
Yep.
And that led to end of life care changes. How do we have the discussion with folks who are, COVID positive? And, a lot was developed during that period of time by, professionals in end of life care, because we approached the COVID end of life care disease process a bit different.
Yeah.
And we also have found that it's really important that we develop education around how do we care for ourselves as we're caring for persons who are dying.
Absolutely.
And, Rachel, what I love about your program too is the fact that if persons do obtain their education elsewhere, and if they have questions, would this apply the 12 hours? They can contact you. They can upload
Yep.
it. You can take a look at it and say, hey, looks good to go.
Yes. So certainly, any accredited training entity, we welcome trainings from, and will, like you said, review course outlines to verify if it meets standards. So we know people have multiple paths of obtaining their education, and we welcome all of those paths. One thing I do want to circle back on that I wanted to talk through when we were talking about the professions is, I know you had mentioned palliative care and hospice, and
Yes.
obviously those are the two settings people probably most think of when they think of end of life care. But this certification does not require that you work in one of those settings. We know end of life care happens in settings outside of those two as well. So I just do want to encourage those that are watching or of interest, if you work in a different setting, we know end of life care happens in many places. So it's not a requirement that you work in a palliative care or hospice setting in order to.
That's a great clarification, because, there are so many different settings that, people die or face end of life care, serious illness, hospitals, nursing homes. We can go on. And it's complex depending upon where that care is given. And we shouldn't have to be in a program of hospice and palliative care to receive excellent end of life care.
Yes, absolutely. So we'll wrap up with one final question, just so the audience can get to know you a little bit. I know you touched on this a little bit in the beginning, but why were you so passionate about helping to develop and being an advisor on the end of life care specialist certification here with Evergreen?
Oh my goodness. How can I say no to something I'm so passionate about? And in my 20 years now, recently, of consulting, after I left the directorship of 20 years, what I love to see is light bulbs pop off. People go, oh, oh. And it's like, if I had experienced people saying, I don't want any more education, I've had it, this is it, different story. That's not what I experience.
Yeah.
Once that appetite is sort of whet and encouraged, people are saying, I want more. I'm hungry for more. I want to do it better. Can I just, if you don't mind me for a moment, just drawing an analogy?
Yeah, for sure.
I used to work in a very large intensive care, CCU, and then I worked in a very small CCU, ICU in Greater Minnesota. And I felt the persons who came in cardiac arrest in a small emergency room versus a huge one deserved the same level of an algorithm. We have advanced life support. Why wouldn't they? So I just compare that to end of life care. Why should we not provide the services in whatever setting we are to the best of our ability? To the best of our ability. And one of the ways to do that is through education and certification.
Absolutely.
And so that's why I'm on the advisory board.
Yeah.
Let's go.
Yes. Well, we have so enjoyed working with you and your input. I want to thank you for joining us today, as well as joining the advisory board and
Thank you.
giving your expansive knowledge of over, as you mentioned, 40 years of experience. It was great to have your knowledge to help in the development process. I want to thank our viewers for joining us today. We hope everyone